Hi guys, Dr. Michael Barnard here at Barnard Chiropractic, and today we're talking about the cervical spine. We're going to be looking at a few x-rays showing what textbook normal is, and then also what happens over time when you lose that curve and you start to get degeneration, arthritis, disc desiccation. I've got this picture here. We're going to go through it. We're going to start up here at the top, okay? Top up here, this is textbook normal. Okay, first thing that we're going to look for when we're looking at this x-ray is we're going to make sure that that curve is there. So you can see this red line, that curve needs to be there because that is evenly distributing the weight of the head throughout the cervical spine. Okay, that's the first thing we're going to look for. Next, we're going to look at the bones themselves. We're going to see if they're nice and square. We shouldn't see any jagged edges, lipping, spurring, osteophytes growing on those bones. We want to make sure that they're nice and square. We're going to look in between those bones. We're going to look at the disc spaces. We're going to make sure that those are nice and full. We don't want to see any disc wasting, decay in between there because they need to be nice and full as that shock absorber. This is really what textbook normal is, and this is what we're looking for when we're looking at x-ray. Now, through different things, car accidents, whiplash, slip and falls, sports-related injuries, poor posture, ergonomics, whatever it might be, we start to go through these phases of degeneration, okay? Typically what we see is phase 1 starting, okay? We've lost that curve. So you can see where the red line was. Now we've got a straightening of the cervical spine. That curve is no longer there. The weight of the head is forward and down, putting pressure on the lower parts of the cervicals. Now in phase 1, we don't see that change happening in the spine just yet. The only thing we see is a misalignment happening where the spine is straight. That's going to happen in the next phase, okay? But we do have a lot of pressure being placed right here in the lower parts of the cervicals, okay? If this isn't corrected, we're going to move down here into phase 2. Phase 2 is where we start to see those changes. Right here, you can see that circle. That's showing us the area that's undergoing that stress. The bones are lipping and spurring. They've no longer have that square shape. They've got that protrusions happening, okay? So in between those is the disc space. We can also see that the disc space is collapsing. This is where we start to see that structural change, okay? And this is beginning to become a problem. If this isn't corrected, then we're going to move down here to phase 3. Phase 3, we see what's called a reversal of curve. So no longer is the curve forward, it's backwards. And the weight of the head is really starting to affect these lower cervicals. So most of the cervical spine is now got arthritis, buildup of lipping and spurring. The discs are all collapsed on each other. Most of the cervical spine is involved at this point. There's a phase 4 and a phase 5. I don't have pictures of those because really at that point you're outside of my scope of practice. We want to try and keep people within this range here because I can help them. When you get down here past phase 3, that's when we start talking about drugs and surgery, really low, poor quality of life. We want to try and keep you out of that range. So this just gives you a quick overview of what happens over time in the cervical spine as you start to degenerate, the arthritis that can build up throughout the spine if you're not taken care of. So go ahead and like this video, subscribe, click the like button below, write some comments. Let me know if you want to know anything else, any other videos that I can post for you. Thank you so much.